Hello, everybody. This is Gary. Today is Thursday, September 22nd, 2022. It's 4 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today I'm doing better than I was yesterday. I finally got word from my landlord that my lease has been recertified. I was waiting for my bank to send information to my landlord through the fax, and they sent the fax to my landlord, and my landlord approved my renewing my lease. I'll be signing my new lease on next Tuesday, the 27th. I was worried because my bank was screwing around with my information and not sending it to the landlord, and I had a deadline that I had to meet, but everything's been taken care of. I'm signing my new lease on Tuesday. As far as my schizophrenia symptoms today, my auditory hallucinations are at a bare minimum. My depression isn't that severe. My anxiety levels are down. My paranoia levels are pretty much in the middle. But I'm doing okay. I am seeing my psychiatrist tomorrow. I'm going to ask him for an increase in my Klonopin. I want to take half a milligram 3 times a day instead of half a milligram twice a day, which is where it is now. He may or may not add something for my paranoia, which has been pretty intense over the past couple of weeks. But I'm doing okay for the most part. I did some work on my computer earlier. I do consumer surveys for extra money. I went out for a walk and I did my physical therapy exercises. My right knee still kind of hurts, even after several months of surgery. I had surgery on May 13th of this year to remove a torn meniscus. My knee still is kind of painful and stiff, but it's not as bad as it was a few months ago. Still taking Cymbalta for physical pain, Flexeril for physical pain, Neurontin for physical pain, and Tylenol and Motrin for pain. I'm not on any opioids or any painkillers like that. There's no point in taking something if I'm just going to become addicted to it. As far as the Klonopin is concerned, I've been on Klonopin for several years at a time and still gotten off with no problem. I don't think addiction to Klonopin is really an issue for me. And I'll be talking to my psychiatrist about that tomorrow. He may or may not add something for the paranoia. Paranoia has been pretty bad over the past couple of weeks, so that's something I'll definitely talk to my psychiatrist about. I was on 20 milligrams, it was like Prexa every day, but then I got urinary retention and they had to put in a catheter because I couldn't urinate, and we reduced the Zyprexa because that might have been the cause of the urinary retention. And if my psychiatrist wants to give you something that doesn't cause urinary retention but helps control my paranoia and my hallucinations, I don't have a problem with doing that, as long as it's not Haldol and similar drugs. The older drugs like Thorazine, Stelazine, Melril, they cause akathisia in me, which means I become physically restless. I can't stop moving. It's impossible to lie down and go to sleep. Akathisia is really, really a physical need to keep moving, and it's really uncomfortable. And I don't want to take any of the older antipsychotic medications because it might cause akathisia, and it's one of the most uncomfortable feelings I've ever had is when I had akathisia. I was getting a shot of Haldol once a month a couple of years ago, but I stopped it because the akathisia gets really bad, and it's like a very horrible experience. There's no doubt that psychiatric medications can have really, really bad side effects, and it's hard to find the right medication sometimes that helps treat your disorder and doesn't have a whole lot of side effects, or at least side effects that are bearable. Because some are bearable, some of them are unbearable. Um, it's different for every person. I would not pretend to say that psychiatric drugs never cause harm or they never cause side effects, because they can and they do. Um, so I've had bad experiences with drugs like stelazine, thorazine, Haldol. Um, very, very uncomfortable, very, very agitated by them. Um, it really depends on the person. Right now, my main antipsychotic medication is Seroquel, and Seroquel has the problem of weight gain. I think I'm up to about 215 pounds. Um, Seroquel tends to shut off that part of the brain that helps you feel satiated when you're eating, and so you just keep eating. But I'm trying to exercise more, trying to control my diet better, trying to lower my blood sugar. I'm not diabetic and I don't want to become diabetic. I'm trying to lower my blood cholesterol through diet as well. So that's pretty much it for now.